So, Sandra, here we are again. So, our November blog, which this month is all about health and well-being for therapists, for physios, for osteos, for chiros. So, we're just thinking about how to manage our own care, our own self-care when we're busy all the time with a very busy career. So, a couple of the things that we want to talk about is how do you know if you're heading for burnout? And how do you know how you can actually try and make your day to day working with patients a little bit less stressful? So,
Okay. Yeah. So if I talk some practicalities, in a previous role, we're very aware that we analysed and we looked at what percentage productivity could people reasonably achieve and stay quite well. And we found that at around if your clinical list was more than 75% full of patient facing time, over a period of time, and it was not as many months as people may expect, people started to struggle themselves with their general health. They became more susceptible to various things. And so what we would suggest is you look really carefully at your diary and you make sure that first of all, you could do as much admin as you can in a treatment time. And we appreciate that's really hard because we all know as hands-on, if it's up to 30 minutes, we tend to spend hands-on or talking for the whole of the 30 minutes. It's if you have that communication, though, about the record being part of the legal requirement that you have to do in the treatment, so you will spend some time doing it, that can give yourself a little bit of breathing space. You may not get it all done, but you've got some of it done. But there's really important you manage that and you set that expectation so people know that you will be doing it. But also, where you put a space in for you to do admin or to catch up on various things, it's really important you keep that space, that you don't let it go unless it is an absolute, really crucial emergency, because that time is your time to finish off doing those things that we've just said. So that you can actually get that time down to a reasonable percentage where you're more efficient and it's sustainable. Because if you go above that level and you consistently go above that level and you start to be sick, then you're not going to be seeing anyone at all. So it's better to manage your time and stay there, to not manage your time and not be there.
mm,
Uh, these are the things, aren't they? I mean, we all know what we do. We all tend to just keep going and going and filling the list and filling the list and taking out, letting admin things in. And we've got to start thinking about managing that time, keeping that time, and managing the time we actually spend already. Are we doing it as efficiently as we could be? And is that because we've set an expectation for customers that perhaps is too high?
yeah, exactly. So, it's just thinking about managing your time, making sure you keep your admin breaks for admin, not squeezing another patient in, and
Absolutely.
recognizing really just measure your productivity over a period of time, and anything above 75% continually, we know from experience that you will get burnout.
You've really got to question, you can't keep going at that.
Yeah. Okay. All
And
right.
so next time, we're going to talk a little bit about some self-help things to be doing when you're at your 75% as well, hopefully.
Okay. Bye.
Bye.